I'm Dr. James Pritchett. I'm here at my downtown Seattle office, and very lucky today to be joined by Christine Hansen, one of my patients for the last 25 years. And what I want to talk about today is the type of hip implant she and many other patients have received now over the last 25 years. We get about 10% or so of our patients that have some sensitivity to metals. So sometimes an earring or a ring or prior orthopedic implant they've had, possibly for a fracture, sometimes even for a joint replacement, and things just didn't work out. They clearly reacted. It's an area that is a worry. We don't have a great test for it. People vary in how much they believe in it. Some surgeons don't think it exists, others think it does, but they don't know what to do about it. It's for the most part not really been medically addressed. Except for now, I can see the answer 25 years later, that ceramic coating of the implant is a way to work at that. The ceramic coating, interestingly, that we applied was done mostly to make it a better wear surface. Ceramics are hard and they don't wear very much in the body, and that's what we thought the advantage were. But we quickly found out that they also reduce the reaction that a patient has to the implant. There's not very many implants you can use for a permanent joint implant. Originally, of course, stainless steel was used, and then in the 1930s, cobalt chromium, because it was stronger, was used. And those are relatively high nickel content metals. Well, it turns out that that's what people are sensitive in more than anything else. It's the nickel part of it. And wouldn't it be great if we could have the strength and the corrosion resistance of a metal, but without the nickel? And admittedly, there have been efforts to address that. Titanium was the main one. And I'm going to show you today a typical titanium stemmed implant. This goes directly with the bone. It's got a texture on it. But titanium is too soft to be used for the ball part, only the stem where it contacts the bone. If you use metal, that metal still needs to be either stainless steel or cobalt chromium, which is a little harder and wears a little better. Because of that, we tried ceramic balls, and this is a Delta ceramic from Germany, again on a titanium stem. The socket has the same titanium backing, and it has a polyethylene interface. This interface could be also ceramic if one chose, or different other polymers, but polyethylene's been the most common. Trouble is that even though titanium is a little less reactive and a little softer than either stainless steel or cobalt chromium, patients, if they're very metal sensitive, still react to it. It hasn't been a full answer. So the additional step that has been the full answer is to coat it. The implants, they come out a gold color when you do that. It still has the same texture. Obviously, the shape and size of the implant will vary according to the patient and its use. But if you put a gold coating, which is ceramic, on it, then this will be non-reactive in the body. And our patient Christine that we had here earlier, it will be permanently. If you won't react to it, and you never will. So even though this process we've been using since 1989, in her case since 1994 when I put it in, it works. And it works for as long as you need it in the body, 25, 30 years. I thought it was timely now, since in the fullness of time we can see this in ways we couldn't. At first I thought it was a nice side benefit of the implant, which was a good implant anyway, and it had good wear characteristics. But the lack of tissue reactivity has been the most important aspect. We've received a few back 25, 20, even as much as 30 years later now, with no reaction in the tissue. And those are donated implants that we get at the time of retrieval, and never seen a problem with it. It's an interesting phenomenon because there's no test that you can do for a patient to find out if they have these sensitivities. It's a clinical history. They tell you about what they're sensitive to, and then You can try. We have different ways of skin testing them, lab tests. One called the LTT, for instance, is popular now, but none of them are very accurate. And so it's a clinical diagnosis. There are drawbacks to the process. One is the coding process. It's expensive. It's also time consuming. It has to be done a very special way. If it's not put on in multiple layers, then it could come off the implant, which would lose all its protective features and possibly become a third body reaction. So these implants are not in common use. I don't think they ever will be because they're expensive and they're time consuming to produce. Most surgeons don't have access to them, most hospitals. There's not a problem with safety. It's more a problem of supply and economics, and those are important issues in our time. Not to be in any way taken lightly. It really does matter what an implant costs and how long it takes to get it. So we use these only when necessary, in the right setting, and when we can find a way to economically make it work out. And there are certainly restrictions on it. Alternatives that have been suggested to a fully ceramic coated have been just the ball itself. And here's a product that's widely available, only costs a few $100s more rather than really several hundred or in the thousands more, where the ball, it's its own type of synthetic ceramic, and it turns it black, and that has been useful to some degree. If somebody's not overly sensitive, it can be helpful too. Again, in the ceramic category, and this one is a resurfacing implant rather than a total hip, it's a fully ceramic part, and it's a magnesium stabilized oxinium or zirconium, and again it fits with the polyethylene socket.
My name is Christine Hansen, and I am very sensitive to metal. I'm allergic to metal. So earrings itch. I can't certainly have any kind of a hip implant, which was what I needed. And then Dr. Pritchett comes along. I find you, and you have a ceramic coated implant, which has changed my life immeasurably. When I was in college and skiing, I fell down and I broke my hip. And the pain was just unbelievable. It was obviously painful, and it didn't make my leg feel any better, and walking was still difficult. And so, what's the point? And then I met you, Dr. Pritchett, and you told me about this new device that is not metal. I didn't realize, of course, that I was allergic to metal. I found that my earrings itched a little bit, but I never made a connection to my body rejecting metal. So, and obviously that's what happened. You told me that. And then you put the implant in, the new one, and it's been miraculous for me, because I've suffered for so long with that hip pain, because then you can't dance or run or exercise, and I like to be active. So I'm really grateful that we were able to find each other, and you gave me the gift of this implant. I've seen so many orthopedic surgeons that were they couldn't help me. They didn't have any suggestions for anything other than the plate and the screws, which, just the way it sounds painful, and archaic. I can do everything. I can ski, although I don't ski too much anymore, but I can dance. I do ballroom dancing, and I do a lot of that, the Lindy Hop. That's a high-speed kind of thing. And, I run a little bit, and I walk, and I see my grandchildren, and, I've been busy, and I've been able to be busy. It's a question that I've asked myself about, how's this going to work out, What kind of pain am I going to have? Am I going to be rid of pain? And it turns out that I can really do pretty much anything I want. And I actually had seen a number of doctors who do this in the past, and no one could offer me anything to help with the pain except medication. And you know, you can't go around taking pain pills all the time. So then I found you. There was a miracle. I had seen so many doctors who couldn't help me, and my whole experience has changed. My life has changed completely. I mean, I can do things I used to do. I can dance, and I can, I was in the marching band at the University of Washington, and that, I had to really work hard to keep marching because it was one of the most exciting, fun things I ever did. So you helped me be able to live a fuller life with my hip not hurting all the time. Oh, I tell everyone I can, because I think a lot of people have problems that they don't talk about, or hips, and especially I'm 75, so that is, I say miraculous, but it really is for a woman my age with a hip problem to no longer have that problem. So my experience has been so different since I had the surgery that I often tell people about it, and because it has changed my life so completely. And I'm not shy, so I talk to people without being asked about my hip. Dr. Pritchett, I'm so glad that I met you and you were able to help me with this ceramic-coated implant, because I was in terrific pain. I couldn't live any kind of a youthful, useful, enjoyable life because of the pain. It's very destructive. And no other doctor could help me. I tried. But so now that I have it, I'm so happy, and I'm so much able to get around, even as an old babe.